Okay, hi everybody. A very good afternoon. Good evening, not good afternoon. Let's just wait for more people to join us this evening. Yes, the time now is 8 o'clock, and we're really glad to have you with us on Zoom and on Facebook Live. This second session of Dear Doctor is streaming live on Lien Foundation and Superhero Me's Facebook page. So please join us and just, we hope you pick up something new tonight in terms of learning. And this is really important for us to let you know that you're not alone in this journey. Okay, great. So my name is Jean. A very good evening once again. I work in early childhood development at the Lien Foundation. I think the foundation is just so privileged and excited to be working with the Child Development Unit from the National University Hospital to put together this series, Dear Doctor. And what's Dear Doctor all about? It's a 4-session digital case management discussion series where we actually want you to talk about real cases, that you can relate knowledge to in your daily life. And for us, really, we're doing this so that we want to really empower you, parents out there, educators, to know that you're not alone in this journey. So the content is provided by the National University Hospital, and this project is supported by the Lien Foundation in partnership with Superhero Me and SG Enable. So this evening we have with us Dr. Tammy Lim, Associate Consultant, Ms. Alison Cheng, Psychologist, and Ms. Hepsi Priyadharsini, Senior Occupational Therapist from the Child Development Unit at NUH. So I think without further ado, we will pass the time over to our friends from NUH. But before that, just a gentle reminder that whatever information is shared in this session is really for educational purposes. If you need help and you find that you're not coping, please go and see a medical professional. Okay. Wonderful. So before we pass the time over to Dr. Tammy Lim, this evening session will be a 30-minute lecture style presentation, following which we will answer your questions. Okay, over to you, Dr. Tammy.
Thank you, Jean, for your kind introduction. I'm Tammy, a developmental pediatrician practicing at the National University Hospital Child Development Unit. I also work with children with feeding difficulties at a pediatric feeding and nutrition clinic. It is our pleasure to be able to share with everyone tonight. Before we begin, if there is anything at all to take away from here, remember that your child's behaviors do not define you as a parent or person. All parents want to do well by their child. You are the best parent for your child. There is no perfect parent. Parenting is a process built on trial and error. When you think you have made a mistake, forgive yourself first and concentrate on doing better next time. Try not to compare yourself to other parents. You are not alone. Having so many of you sign up for tonight's session and sending in your questions is testimony to this. In the second half of tonight's session, we will have a group discussion with parents to share the challenges they are experiencing with their children's behaviors. Our team will try our best to discuss some strategies that may help. This is the outline of tonight's webinar. We will start off with a case study first, and then move on to understand and analyze behaviors so that we can have a targeted approach for our children's behaviors. If all else fails, we will discuss what to do if your child has a meltdown. So this is Sam. He is a 6-year-old boy with autism. He has limited spoken language skills. He's the youngest of 3 children, and his eldest brother has intellectual disability. He lives with his parents, siblings, and grandmother in a HDB flat. He usually attends school and early intervention program. However, both have stopped during the circuit breaker. Sam has been screaming very loudly at times, giving his parents a lot of distress. His neighbors are also very disturbed by the screaming and have called the police several times. Sam's parents feel very helpless. They have kept him at home throughout this period, as Sam refuses to wear a mask and his parents are afraid of getting fined. Keeping in mind Sam's case, first, what are challenging behaviors? So challenging behaviors are behaviors that cause significant harm or disruption to oneself or others. They may result in someone being excluded from activities. Behaviors can be diverse and be different in every child. Some examples include self-injury, such as head banging, skin picking, hurting others, for example, hitting, kicking, or biting, not listening to instructions, for example, refusing food, not wanting to sleep, or even tantrums and meltdowns. There is a purpose for every behavior. When your child is misbehaving, take a moment to remind yourself that your child is not trying to make things difficult for you. Your child is in fact trying to communicate with you. Young children or children with limited spoken language may communicate their needs and wants using behaviors. Let's look at the possible reasons for behaviors and what they could communicate. Your child may be trying to access or escape something through his or her behavior. In terms of accessing, behaviors can be to access something, for example, your attention, a desired toy, sensory input, for example, through chewing or biting. Behaviors can also be to escape a demand. For example, I don't want to brush my teeth, I don't want to do my homework, or I'm trying to escape a sensory input. For example, I don't like that sound, or the light is too bright. Sometimes children have certain behaviors because they are experiencing physical discomfort or pain due to medical or dental issues. For example, your child could be banging his or her head due to a headache or toothache. Other physical reasons can also include simple things such as feeling tired or hungry. Fourthly, your child could be trying to communicate his or her emotions through his or her behaviors. Anxiety and frustration from difficulties understanding what is happening around them, or due to sudden changes that they are not used to, can result in more challenging behaviors. This is something many parents can identify with during this COVID-19 pandemic. Frustration may also happen in the initial stages of a child learning a new skill. For example, trying to put a coin into a slot but not succeeding at first, and when the child feels like he or she has no control over what he or she wants to do. Be mindful also of how we may affect our child's behaviors. Some parental factors, such as stress, anxiety, lack of sleep, financial or housing worries, can have an effect on the way parents perceive the child's behaviors, and also how we may approach and respond to the child. This may in turn contribute to the presentation of or worsening of the child's challenging behaviors. It is also important to note that some self-injurious behaviors can happen when a child has difficulties communicating what he or she wants using words and gestures. We will now go through a framework to help us understand and manage behaviors. So let's break down behaviors into A, B, and C. A stands for antecedent. What happens before the behavior gives us clues to the child's intention. Who was involved? What item was involved? For example, a desired toy? Does it often happen during a specific time of the day or when a specific event occurs? Does it happen in one place more than others? B refers to the actual behavior. This could be screaming, kicking, throwing, etc. Be as specific as you can in naming the behavior as this helps us to know what we are targeting to change. C refers to consequence, which is what happens immediately after the behavior. Over time, the A and C of the behaviors influence whether the child is likely to repeat the same behaviors. Here are some common examples you might be familiar with. Let's look at each example and discuss the reasons for the child's behavior. In the first example, the mom closes the door and the child starts to scream and kick. The mom then opens the door and the child stops crying and goes to the door. The likely reason for the child screaming in this case will be wanting access to going out. The second example here is something that is not uncommon during meal times. Dad tries to put the child in the high chair for a meal. The child straightens the legs, cries, and resists sitting. Dad then carries the child out of the high chair. The child stops crying, wriggles, and looks at the ground. The likely reason for the child's behavior here is wanting to escape the demand of having to sit down for a meal. And the third example here is something many of us can relate to during this circuit breaker. Mom is in a Zoom meeting. The child cries and pushes mom's phone away. Mom stops the meeting and carries the child. Child calms down and hugs mom. The likely reason for the child's behavior here is wanting to access mom's attention. As mentioned earlier, the A and C have great influence on whether the behavior is repeated or even escalated. There are three ways to change behaviors. Firstly, changing the antecedent. Antecedent strategies can be put in place to prevent or decrease the likelihood of challenging behaviors occurring. These strategies can act as a reminder and increase the likelihood of appropriate behaviors happening as well. Secondly, teaching appropriate alternative behaviors that are desirable. Thirdly, changing the consequence. Such strategies are used in response to the behavior depending on whether it was appropriate or not. I will now hand over the time to Ellie to discuss some specific strategies.
Okay, thank you, Tammy. Hi, everyone. I'm Alison, a psychologist with NUH CDU. So we'll start with common strategies we use to change the antecedent to reduce the likelihood of challenging behaviors. So first, remember your ABCs of behavior and think about the possible reason for your child's behavior. Is it to get something, escape from something, because he or she is physically unwell, or is it an emotional reason? If you suspect your child might be unwell or have pain somewhere, seek medical and dental help to rule out such causes. If it might be because your child is tired, then coax them to rest. If it's near a meal time, perhaps your child is hungry. Last week's webinar by our colleagues, Dr. Aishwarya and Occupational Therapist Jing, discussed the importance of routines and how to implement them. For more details, visit the Superhero Me Facebook page for last week's video. Okay, so here are some strategies to consider when communicating with your child. First, ensure you have your child's attention before speaking. If your child's engrossed in another activity, he or she may not hear you. You may end up repeating what you said many times, annoying yourself and possibly your child too. Okay. Also, prioritize instructions. Say what is important first and be concise. If long instructions are given, your child may only hear the first or the last parts. So for example, if you said, "Daddy will be back soon, so prepare to sit down for dinner. Clean up all your toys, then wash your hands before you come." You may have wanted your child to immediately clean up his toys, but what he might have heard was Daddy being home soon or to wash his hands. So prioritize. Say, "Clean up your toys," wash your hands, then sit down at the table. If your child currently manages instructions of fewer steps, break the instructions down step by step. So wait for your child to complete an action before giving him the next instruction. Give statements instead of questions. If it's bath time, for example, tell your child, take your bath. If you ask your child, do you want to take your bath now? Your child might very well say no, and this may end up as a tantrum. Okay. Use do instead of don't statements. If you tell your child, don't run, it may not be immediately clear to your child what is expected of him or her, and your child might start climbing or doing cartwheels. So instead, tell your child, walk, please. Now, some children with limited understanding or limited language abilities may require visual supports to understand what is expected of them. Here are some examples of visual supports that you can use. So a first-then board can help a child understand that first, he or she has to complete the meal, then he or she gets to access an activity that he likes, such as going to the playground. Okay, here we have a first wear a mask, then go to the supermarket. Okay. Last week, our colleagues talked about visual schedules. So visual schedules break the day down into steps and help a child understand what is expected throughout the day. Other specific pictures like a stop sign may also be helpful too. You can display this on the door if a room is out of bounds as you're having a work meeting, or if it's raining and your child can't go outside to play. If your child is bored and wants to do something else, but does not know what to do, you may like to prepare a choice board to help your child understand what else he or she can do or play with as an alternative. Be sure to only include activities and objects you are able and willing to provide should the child pick it. Now, besides changing the antecedent, we can also explicitly teach desirable replacement behaviors. The replacement behavior should serve the same purpose as the challenging behavior. So again, remember your ABCs that give you clues about the reason for the challenging behavior. Here's a suggested framework for how to think about what you can teach your children. First, ask yourself these 3 questions. Number 1, what does my child do now? Number 2, what is it that he or she wants? And number 3, what can my child do instead? Is he or she able to communicate in another way? Now let's use a previous example. So in this case, we've established that the reason for the challenging behavior is to gain access to an activity like going out. Okay, what other behaviors can your child realistically do instead to achieve his end goal of getting the activity? Okay, so if your child has some speech, we can encourage your child to make requests with his words. So model an appropriate request by saying, go out or open door, and wait for them to repeat it. If your child is just beginning to speak, it does not have to be very clearly articulated. Immediately reward their efforts of repeating the words by opening the door. You can also teach your child to point or use a gesture to indicate what he or she wants. Again, you can model pointing to the door, or you can use hand over hand guidance if necessary. So take your child's hand, put out a finger, just like that. Okay. If your child has limited spoken language, consider providing relevant picture cards that your child can bring to you to let you know what he or she wants. Now, it's important to practice these replacement behaviors when you and your child are not stressed. So try it during playtime. You may use a prompt. So a prompt is like a hint that guides and leads the child to doing the right thing. You can be a role model by doing what you want your child to do. Show your child how he or she can ask for your attention, such as calling your name, tapping on the shoulder, and then reinforce these behaviors by providing attention when your child does so. If your child is trying to gain access to a snack or a toy, for example, a verbal prompt might be saying something like, Say, I want. Okay. And visual supports like the ones we showed you can act as prompts as well. Remember to reinforce immediately after they demonstrate these behaviors by giving them the desired item. Okay, also, avoid letting your child escape the task with his or her behaviors. If your child runs away when you ask him or her to pack the toys, redirect your child back to the task, complete the task with your child, and then reinforce immediately by giving them access to the preferred next activity once your child has done packing. If it appears that the task is too challenging, simplify it, then reward. So if, for example, instead of having your child pack up all the toys, reduce it to just putting 3 toys back first. Okay, the next question to ask then, next slide, thank you. Yeah, the next question to ask then is, how do I reinforce desired behavior? Okay, we can reinforce desired behavior by changing the consequences, meaning change our responses. To encourage more desirable behaviors in the future, give your child attention and little rewards. Such reinforcements should be immediate. So right after your child displays that desirable behavior, it should be consistent. So you reward your child each time he or she displays that behavior you are working on, not just sometimes. And it should also be done in various settings so that your child is able to generalize the skills across settings. Also, avoid giving attention until your child attempts to or does what is acceptable. If your child is engaging in challenging behaviors like screaming or crying for whatever reason, avoid eye contact and avoid talking about the behavior. Do not give it attention while keeping your child physically safe. Do what you can to block or protect your child if necessary. For example, if your child is banging his head against the wall, hold a pillow between his head and the wall. One thing to note, if you find that you have great difficulties tolerating challenging behaviors and will eventually give in to your child's demands, please give in immediately to avoid encouraging the increase of such challenging behaviors. But if you are determined to stand your ground, do so to the end. Okay, be generous with your praise and rewards. These have been shown to be very effective in increasing desirable behaviors. Now, parents, you know your children best. So some children like verbal praise. When praising your child, remember to be specific so that your child understands what he or she is being praised for. So say things like, good job keeping your toys. I like how you ask nicely. Other children may respond better to something physical, like a hug or tickles. Some may prefer something tangible, like a special toy, or other activities, like listening to music. Some children may also desire sensory stimulation by engaging in sensory-seeking behaviors. So allowing your child to spin an item or his or her own body sometimes may help your child feel good. Consider using a reward menu or a chart, like the ones on the next slide. So with these, children can earn stars and exchange them for something that they like on the reward menu. Okay, now at this point you may ask, or you may say, I've tried all these strategies, but my child's behavior seems to be getting worse. Now, challenging behaviors almost always get worse before it gets better. So hang in there. This is a good sign as it means you have identified the right function for your child's behaviors. At this point, your child might be thinking, my screaming is not working anymore. Maybe I need to scream louder or throw in a kick or pinch, you know? So parents may also find that punishment for challenging behaviors seem to work faster. They do seem more effective in the short run, in the moment. However, you may find your child resorting to other challenging behaviors to get what he or she wants instead. So to see long-term changes in your child's behaviors, focus on using reinforcements. At the same time, teach replacement behaviors. Okay, parents may also consider allowing natural consequences to teach your child that such behavior is not right. So if your child scribbles on the table or on the walls, which I hear is pretty common, with his crayons, get your child to clean up together with you so that your child learns that it is wrong, okay? Now, I'll hand the time over to my colleague, Hepsi. Thanks, Hepsi.
All right. Thank you, Alison. Hello, everyone. I'm Hepsi. Now that we have discussed all this, let's bring it back to Sam and see how we can help him. So now let's take a look at Sam's behavior using the ABC framework Dr. Tammy and Alison talked about. What do you think is the purpose of Sam's behavior? From the initial consequence, we cannot tell what the reason was for these challenging behaviors. However, when the consequence was changed by the grandmother, we get the clue. When grandmother gave him another toy, Sam calmed down. So it's likely that the screaming and the crying was his toy was taken away from him by his younger brother. So the reason for this behavior is a need to access and get the toy. So let's also review other possible contributing factors for Sam's behavior. It's no more going to school, no more going to early intervention center, which is the EPIC centers. The siblings are there at home all throughout the day, and the loss of routine. So like missing his nap time, sleeping late, change of caregiver from childcare to grandmother. So all these environmental changes happening during the circuit breaker makes it even difficult for Sam to adjust and adapt to them and resulting in these kind of challenging behaviors. So here are some specific strategies that we are likely to reduce Sam's screaming. So we'll look at the changing of the antecedent. Maybe the grandmother can be more consistent with managing few routines like nap time and meal times. So she can use a visual schedule, as we talked about them earlier, to help Sam understand the accepted routines of the activities of the day. The siblings can have different boxes of toys, so each of them get their own, and we can swap the toys and we can rotate it every 2 to 3 days. It also provides some structure for these boys because they can know how to play on their own. Moving on is the teaching the replacement behaviors. So the behaviors and the reinforcement, as some limited language abilities, he can use gestures to indicate what he wants, and when he wants a toy instead of screaming. This could be reinforced by praising immediately, as Alison just now mentioned, and this is more for expressing his needs, so he no need to scream. Another reinforcement could be to allow Sam to play with the Legos for slightly longer before giving it to his younger brother. And so this will help him to prepare for the next activity as well. Remember, whatever behavior you're trying to target each time, as this is what makes all the difference. Mask wearing. So we would like to reassure parents that the Ministry of Health recognize that children with special needs may have difficulty complying with mask wearing. So there will be flexibility when the mask wearing is enforced for children with special needs. I would like to draw your attention to this resource, which is being created by a team at NUH Child Development Unit to help children learn how to wear masks. But because of the time constraint, I will not be able to take you through the entire resource. Now let's look at the meltdown SOS. Tantrums and meltdowns. They both can look similar, but they're not the same. Both of them have similar behaviors: kicking, shouting, biting. And all these behaviors need your attention, but how we understand and respond will need to be different. So let's look at an analogy of how a human brain, especially for a younger child, is. So if you're going to take it like a 2-story building, it needs to be built on solid foundation. So we can have like a downstairs portion of the brain and the upstairs portion of the brain. The downstairs portion of the brain is the emotional brain, which develops first, and it is there since birth, and it controls all our basic functions. It basically shuts down all our reasoning and understanding. Whereas the upstairs part of the brain is the logical part of our brain, which is responsible for higher thinking and impulse control. So for this child, as he develops, the child starts going to school. He needs to follow classroom routines, follow instructions, play together with other children in the classroom. So there's a lot of different things he has to learn. Moving on to tantrums again, as parents, we're all familiar with it. If a child wants an ice cream, say for example, he knows that he wants an ice cream, he lets you know that, and once you say no, you can see all the tantrums come out. So he'll be kicking, biting till he gets that ice cream. And once he gets the ice cream, that behavior will stop. But whereas a meltdown, on the other hand, is a full body reaction. And it is an overwhelming reaction which can happen because of the triggers, which happens either within himself or in the environment. This might be a result of a sensory overload. So here, let me give me an example. So for a child who is auditory sensitive, so he might be on the spectrum, on the autism spectrum, and when he hears sudden loud sounds, he might just cover his ears. But because of the circuit breaker, there are so many people at home. So parents are at home, siblings are there, they are doing the online classes. And so there are physically more bodies in the house. And the environmental sounds also can trigger them. And because of these triggers, the child will go into this meltdown and he will escalate very fast and very quickly. So ways to stop tantrums and meltdowns. So the tantrums, we can assign a calm space because not every time he's going to get his way. And in this calm space, he can have his own calming music, calming down jar, or even some use of essential oil, a soft toy, a pillow. And you can get him to hear some of the rules and you can set some clear expectations for him. Whereas for the meltdown, you cannot stop a meltdown and you have to allow it to go through the acting out phase. Before the meltdown happens, if you already know, as the example which I gave just now, the auditory sensitivity, then you can try to reduce or minimize the triggers. But some of the triggers are known and obvious, but not all are known. So when in those kind of a time where he is going through this meltdown phase, you have to ensure that the child has a safe environment because he can throw a tantrum or meltdown and he will be like throwing himself on the floor, on the sofa. So you just have to be very mindful of the environment. And many of our parents say the child will be refusing to be picked up at this point. So the behavior for this particular tantrum will stop only when the child calms down and regains control. The key is a calmer brain, so means a fewer tantrums and fewer meltdowns. But you might ask me, despite all these measures, what if the child still has a meltdown? So what you can do is first and foremost is to provide comfort for your child to make him feel calm, safe and loved. So for some children, it can be hugging, slow rocking, sitting with your child, quietly singing, so that brings comfort. Secondly, acknowledge his emotion and show that you're present and available and understanding how he is feeling. And lastly, you can try to negotiate with your child. And once the child is calmed down, you can continue to reinforce the limits. And if he's ready, you can talk to him. This is a resource which is put together by our CDU team, supporting you and your child's emotional well-being. You can find in the link below. So there are different scenarios in there, what might be going on in the child's mind and as a parent yourself. So here you can look at some strategies that you can try out with your child as well as for yourself. So what do you do if you're losing your temper? For many parents, it's been a lot of juggling lately and it is not easy. In moments of frustration, what do? Do you go and punch a pillow? Is it going to go for a run? Or is it just to take a step back? Yes, I think when you feel you're losing a temper, Move away from the trigger if possible and take few deep breaths. Deep and calm breaths really help you to calm your brain, and it makes you more empathetic. It might sound very simple, but it is effective. So you can model the positive behavior. I need to cool down. I'm going for a walk, or I'm going for a drink. And our children know better which buttons to push to get us to attend to them. So if you're unable to control and sometimes you lose your temper, you can share how you're feeling with your loved ones. And if it's more than that, and if you feel that you're losing a temper often, you have to seek some professional help. But don't be harsh on yourself. Be quick to forgive yourself and try to do better the next time. As you've already been doing and being the best parent you can be for your child during these uncertain times. With this, we have come to the end of the first half of our session. Thank you for your attention, and let me hand over the time to Jean. Over to you, Jean. Thank you.
Thank you. Thank you, Ms. Hepsi. And I think, you know, there's just so much that we've learned just by listening on how to think, look at the child and what's happening beyond the behavior. So I think going on to the next slide, before we move on to the Q&A, we've put together some resources for parents and caregivers available on the Child Development Unit website. Not to worry, we will put links on the Facebook comments as well as email the Zoom participants these links. And I think moving on, there is also a survey that the NUH Child Development Unit team is working on. Please help if you are a parent or caregiver of a child with developmental disabilities. The team is looking for volunteers to take part in this survey, in an anonymous online survey, to really see how to assess the psychological impact of COVID-19 on parents and caregivers in Singapore. And if you are a service provider, so you could be a teacher and an early interventionist, there is a survey for you as well, just to think about, you know, how this has impacted the way your services have been delivered. Okay, wonderful. Moving on to the Q&A session. I think, you know, the questions that we've plucked out this evening is really a representative of the many struggles that some parents are facing. So out of all the questions that came in, we had like, I don't know, 180 questions, and we've kind of distilled them into key themes. And I think I would be helping some of our parents ask the questions on behalf of them. So let's move on to the first question this evening. So the first theme that came about quite strongly is really about anger management and violence. So parents said, you know, with COVID-19 escalating, the child is hitting and pinching, screaming, shouting, and slamming doors. She used a visual and talk nice discipline. Nothing is working. So this is a parent whose child is 7 years old with autism and attends EPIC. So maybe for this question, Ellie, would you like to have a shot at answering it?
Yeah, thanks for the question. I think we've been getting this question much more frequently this season. So I'm going to apply my ABCs of behavior. Yeah, let's start with the easiest, the B, behaviors. So here we have hitting, pinching, screaming, shouting, and slamming the door. Now let's think about the A, the antecedents. What happened before these behaviors occurred? From here, I assume it is the COVID-19 measures of staying home that resulted in increased frequency. However, I'm not sure what exactly happened before each of these behaviors, so it's quite difficult for me to determine what exactly your child was trying to communicate. So we need more information, like what happened immediately before, when during the day did it happen, does it increase or decrease in the presence of certain individuals, maybe? Okay, and finally, if I look at the C, the consequences. So I see here you've tried various things and I applaud your efforts, so great job. Well, one of the possible reasons for why they're not working could be because it does not quite address the reason for the behavior. Okay, so some homework has to be done in this case to take more specific notes on the ABCs of behaviors before we can do something really targeted. Nevertheless, this does not mean that there's nothing we can do now. We can still work on changing the A, So we change the antecedents. Okay, as the behaviors seem to have increased after COVID-19, start by creating and sticking to a regular daily routine, so one that is similar to your child's pre-COVID routine. Children with ASD are often quite anxious about the unknown, so setting a routine and using visual supports can help to structure the day, making it more predictable and reduces anxieties that the children may have. So as my colleague Jing said last week, having structure does not mean you have to be rigid. If there are changes that have to happen, just let your child know in advance. Okay, another thing we can do is to explore and rule out physical reasons like pain, sleep, and hunger. Many children have disrupted or changes in their sleep routine during this period, which could give rise in more challenging behaviors. So try to keep to the same routine as when your child, went to school. Also, look out for upcoming resource on how you can prepare your child for school. Yeah, so we worked on that. Look out for it.
Thank you, Ellie, for the answer. Let's move on to the second question that really popped up quite commonly among all the questions. So, we have this parent here whose child is 3 years old with delayed speech, requiring early intervention. So the parent is unable to identify what are the triggers, and the child is always using screaming and crying to express herself instead of speech. Hepsi, would you like to share some of your thoughts?
Yes, sure. Hi, Jen. Thank you for your question and can understand the screaming frustrations. You're not alone. We hear similarly from other parents too, as behavior and communication are often interconnected. Although there are many reasons for these types of behaviors, it can often be linked to a breakdown in communication. So when I say breakdown in communication, I mean the child is not understanding what others are saying to her, or they are unable to express what they want to say in a very appropriate manner. So in other words, screaming and shouting are the only ways, they're currently most effective ways to get her needs met. So in order to help her communicate her needs in more appropriate manner, you can look and observe during those challenging behaviors, is there any other triggers? Is there any subtle warning signs that the child is displaying for you to understand, oh, this is coming? All right, so you can use alternate communicative measures as well, like with pictures. You can pair it with your voice, your gestures, your body language, so the child understands what you're trying to say. And when you're talking to a child, so try to calm down, and you can break it down into small sentences, simpler sentences, and then allow some time for your child to process that information. And if you really need to repeat that instruction, you can use 2 or 3 keywords. Yeah, but we also can understand that we, as parents, we want our children to speak. And then during this challenging time, it can be quite difficult for our children to access those words and to use them. Because even as adults, when we are excited or when we are having a full-blown emotion or feeling, it is hard for us to find the right word. So what we can do is you can tell from your child's perspective, I'm sad, I need a hug. So then the child hears it, and then the child will be able to use it in future. Since your child requires early intervention support, so the speech language therapist will be the best person to do the assessment on the communication abilities, and then they will be able to suggest certain ideas and strategies that you can do. And hopefully these challenging behaviors will calm down. And thanks for your question.
Thank you very much, Hepsi. I think with that, we have a parent in the room with us who will ask the third question. Ms. Ashley, I'm going to unmute you. Yes, would you like to ask your question?
Oh yeah, okay, my son, he is 4 and he has the habit of climbing high up, in the house. He will climb up like the dining table or even up the piano, and he will scream a lot for fun or when he's frustrated, so even when we try to remind him, like we'll tell him shh or keep quiet, he will either ignore us or he will purposely scream even louder. So it's driving us crazy.
Thank you, Ashley, for sharing. Hepsi, would you like to take the question?
Yes, I will. Yeah, this is a question which we hear frequently too. And thanks, Ashley, for asking that question. I can hear your frustration. When you say that it is like, no, sometimes you have to constantly nag, you have to remind them. So it may be like, you have to use a different tool from your toolbox then to manage these kind of behaviors. As sometimes as parents, we need to be aware of our own personality and our temperament as well. And any big difference in it can also trigger a power struggle with our children. So we need to be mindful of that. And as parents and educators, our behaviors are the ones which is more something which you can adjust faster. So it is one of the most powerful tool that we have. And when we're talking about stimming, climbing, and all, so the stimming is usually refers to self-stimulatory behaviors. So usually it involves repetitive movements or sounds. So for us also sometimes when we are nervous or when we are bored, we'll be biting our own fingernails, we'll be twirling the hair. So then all these are self-stimulatory and calming behaviors. So the stimming behaviors are basically there to help us cope with these behaviors. So it's either it stimulates the behavior or the senses, or it decreases the sensory overload. And sometimes it can be even because of boredom. And then they don't know what to do, so climb on the piano. All right. So it can be also like wanting to get your attention. So we really need to know what is the cause for these kind of behaviors. And because of this circuit breaker, you can see there's a lot of uncertainty and changes. So we need to understand that stimming would be more than usual. And that is okay for the time being. And especially for our children who are on the autism spectrum disorder, the stimming behaviors it's more obvious and they can go on and on for long periods of time. And this is because they're less socially aware of the behavior and it becomes slightly annoying and disruptive to us as well. So in order to answer how we can help to reduce the stimming behavior, we need to know why is it happening. If you stop one behavior, then another one will come. So we need to know what is the reason behind that stimming behavior, because the other behavior which comes out might not be better as well. So secondly, we have to find acceptable alternatives. So in your case, your son is climbing all over. So he needs some clear and specific boundaries on when and where he can climb or where he can move around the house in a safe manner. So you can schedule some regular movement activities, simple exercises, which you can do. You can get him to do some animal walks, wall push-ups, or even like some YouTube channels as some kids yoga. So what happens, he gets that movement or the sensory input in order to sustain throughout the day so that it's in a very safe and it is an acceptable alternative. And as a family, you can also have a workout or an exercise routine. Yeah, so that might also help. Hope this answers your question.
Thank you, Ms. Hepsi, for that answer. And thank you very much, Ashley, for sharing with us what you're going through. Moving on to question 4. I think the next question, I'm going to ask it on behalf of the parent who has chosen to remain anonymous. A parent whose child is 3-year-old with suspected autism. It's all about task avoidance. So he cries and uses going to the toilet as an excuse to avoid learning and games. The parent has even gone as far to monitor his water intake to determine if he really needs to go to the toilet. She also tries to comfort and be with him, but he still resists because he's only interested in playing with his fingers. Maybe Dr. Tammy, would you like to take this question?
Thank you for the question. And I see that you have really tried to troubleshoot why your child is doing this behavior. So task avoidance is a very common problem that many parents face. Just like us, our children have likes and dislikes, and quite naturally, play is much more fun than doing homework or tasks that they find difficult. So in such a scenario, first consider if your child understood what was expected. If not, consider the strategies that we shared earlier on effective communication with your child. In this case, because your child is actually young, you could also consider using some visual supports to enhance the communication with your child. Secondly, is the task too difficult for your child? You may want to lower your expectations for difficult tasks. Help your child to gain confidence first by starting with tasks that you actually know your child is able to do. You could also consider whether you could alternate some easy and difficult or less preferred tasks, or allow your child to choose a reward prior to doing the task. And once your child actually completes the task, reinforce your child immediately by giving a reward. When getting your child to sit for any learning activity, try to include frequent short breaks. A visual work break schedule will be helpful to let your child know to expect a fixed number of items or fixed amount of time for learning and then a short break. So if your child actually chooses to go to the toilet, take it as a break, and after which your child has to return to the task. A timer will be helpful to provide a visual as well as an auditory cue to your child to signal the start as well as the end of each activity. It is very important to remember to keep to your word. Whenever you say that you set a certain number of tasks or a timing for the activity, we have to keep our promise. The timing of the day matters as well. So children's attention and moods are often better in the morning. So you may want to consider scheduling the more difficult or less preferred tasks in the morning. Children also learn better through play. So make the learning activities fun and use your child's interest to motivate him. So for example, if you know that your child likes Thomas Train, then you can use the various train characters to teach your child colors. So for more strategies, visit our website. We have an infographic on managing learning at home.
Okay. Thank you, Dr. Tammy. And I think the next question is for you as well. Worries of regression. This actually came from an educator and early interventionist who works with children aged 2 to 8 years old. She's worried because she thinks, all parents have difficulties at home, and most feel that at the end of a day at school, they should be allowed to do as they please. And trying to change this way of thinking is quite essential to her work. So how is it that educators or even parents can think about how they spend time at home to prevent regression and not worry about it?
So thank you for highlighting this very important point. I've heard a lot about worries of regression, both from providers as well as from parents. This is a very real question. So from a parent's perspective, I feel you, because honestly, after a very long day at work, I often don't have the bandwidth to do anything much. So sometimes when my child screams or hits his head, I may be too tired to really think about the ABCs of behavior. So I can actually imagine that the bandwidth to continue doing home intervention will be even less. However, from a provider's perspective, it is crucial that the skills that our children learn in early intervention be practiced in various settings, including the home setting as well as in school. The reason why is because this helps the child actually learn to apply the skills even after early intervention has stopped. So how then do we reconcile this within the practical limitations that we have as parents? So going back to what we first started off with tonight, remember that you are really the best parent for your child and you are trying your best. So there are some ways in which we can weave in some of the strategies your child has learned in the early intervention program. For example, set achievable goals for yourself. So maybe the easier or the smaller skills to work on, you can save that for weekday evenings, and the more difficult ones for weekends. Prioritize what is important to you and work on one thing at a time. You may also consider embedding the strategies into your daily routines so that it doesn't feel like you have an extra thing to do after work. You may also refer to our activity resource book, helping your child learn through daily routines. Accept that there will be some days that you won't be able to practice the skills, and that is really okay. Get back on track when you are next able to. If there is another caregiver in your household, divide and conquer. Allocate the skills or the tasks based on each other's strengths. Whenever you face difficulties, which are bound to happen, have an open discussion with your child's therapist so that your therapist can help you to troubleshoot. It is also very important to communicate with your child's school teacher on what your child is doing and learning in the early intervention program. Encourage your child's school teacher to practice the strategies with your child. And lastly, remember you are not alone. There are many parents too who face similar challenges and worries. So it will be very helpful to join a parent support group so that you can give one another encouragement, affirmation, and also share strategies on what has worked for one another. A word of caution that I have is that every child is different. So that if you have very specific concerns about your child, it will still be advisable to discuss directly with your child's doctor or therapist.
Thank you, Dr. Tammy, for that sharing. I think the last question tonight that, it's something that everyone faces, no, the common trigger of saying no. So a parent who has a 6-year-old son diagnosed with moderate autism and mild intellectual disability, he says he's very insistent when he wants something and attempts by crying, whining, and is very stubborn. And as a parent, we usually try to distract him, wait out his whining, or give in to him. And I think this is really something quite common that many parents face. So, Ellie, would you like to take this question? The common trigger of saying no.
Okay, so thanks for the question. Some might describe your son as determined and persistent. Okay, now generally nobody likes to hear no for an answer, but sometimes there are things we want that are not good for us, or it's just not the right time for us to have, right? So I think distracting and waiting out are acceptable strategies depending on what your goals and targets are. So try to be clear about your expectations and consequences, and then communicate that to your child as well. So you can first start with some A strategies, antecedent strategies, like using the first then schedule or providing alternatives that he can have through a choice board. It is also all right to distract him with something else. Okay, while you are waiting out his whining, remember to stay calm yourself, as the constant chatter or if you're panicking may overwhelm the child further. So do some deep breathing. Encourage your child to do it with you if possible. It's fine if they don't do it, you do it yourself. I found that sometimes just facing a child who's crying and doing deep breathing on my own calms both myself and the child down. And it also gives me a bit of time to think about reasonable alternatives I can offer to the child as well. Okay, about giving in, I generally would avoid it, especially when he's crying or whining, because the consequence, which is my response of giving in, acts as a reward for his crying and whining. So rewarding the behavior encourages it and makes it more likely of happening again. However, as Tammy said, we are not superhuman, and sometimes we have hard days and we feel low. So on those days, we may not be able to handle or wait out our child's behaviors. Then give in immediately on your child's first try at requesting. Okay, it's all right to rest and take a break. Try again tomorrow. Don't undo all your hard work by letting the challenging behaviors escalate and then rewarding them. Yeah, so that's my answer. Thanks, Jean.
Wonderful. Thank you, Ellie. And I think we have gone through 6 very, very common questions that most parents at home might face. And I think just to maybe wrap up tonight's session, thank you so much, all of you, for tuning in and watching this on Facebook Live. Again, just trying to highlight the resources that the Child Development Unit has produced together with the Lien Foundation, Superhero Me, and SC Enable. You can, download it, stick it on your fridge, just somewhere to remind you that you're not alone on this journey. And next, again, we need your help if you are a caregiver, a parent of a child with developmental disabilities. Please help us in this study that will help to maybe reshape the way services are being done in the future. And if you are a service provider, early intervention teacher, social worker, this survey is for you. We will send a link out to our participants who registered via Zoom. Okay. Wonderful. So I think before we end off tonight, thank you so much for your time.